Hi, this is Michelle Garcia. I'm doing my presentation on Trichotillomania. I apologize. I will probably mix up this word quite a few times as we go throughout the presentation. So please bear with me. Um, Looking at what trichotillomania is, it's a disorder that causes people to pull out their bodily hair. Usually, the most popular sites are the scalp, eyelashes, and eyebrows. But it does include also pubic area, underarms, beard, chest, legs, and other various parts of the body. And with this hair pulling, there are noticeable bald patches. It's listed in the DSM-5 as an impulse control disorder, where some research has also viewed it as being an obsessive compulsive disorder. Some of the diagnostic criteria within the DSM is recurrent pulling out of one's hair resulting in hair loss. B, repeated attempts to decrease or stop hair pulling. C, the hair pulling causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. D, the hair pulling or hair loss is not attributable to another medical condition, such as any dermatological conditions. The hair pulling is not better explained by the symptoms of another mental disorder, such as attempts to improve or perceived a defect or flaw in appearance in body dysmorphic area disorder. Some of the associated features that are listed within the DSM-5 is the accompanying of hair pulling. The individual may experience other behaviors or rituals, such as the particular hair being pulled, which is basically the particular part of the body that they prefer to pull from. A specific way of pulling hair, which is usually sometimes when you do pull on your hair, it doesn't come out by the root. But some of these individuals with this disorder have a ritual or a behavior where they want to pull out their hair by the root. They visually examine their hair once they pull it. They manipulate their hair by rolling it through their fingers and eating and biting their hair, which ends up in them swallowing it. Some of the emotional states that may follow are anxiety, boredom, increased sense of tension, and then a gratification, which is a sense of relief or pleasure. Some of the warning signs that you can see with these individuals is they wear hats or handkerchiefs or wigs, usually to cover up any bald spots, especially on the scalp. Wearing lots of eye makeup or glasses, excessive fiddling with one's hair, a preoccupation with anxiety, depression, career or academic decline, avoidance of windy and wet situations, which would include swimming, and changes in social behavior patterns. I added this in here for medical complications only because of where I work in a children's hospital, and what I have experienced and seen, which I've never seen before other than in the last year, is we have patients coming in complaining of digestive problems, stomach pains or not being able to digest properly. And we have found it's results of these individuals pulling their hair and eating it, which, as you can see in the photos here, that's actually hair. That's a lot of hair that's just been built up in the stomach, and usually when they do pull it out, it is in the shape of the stomach. So they have to surgically remove it. And the youngest girl that we've had in there with the surgery was 5 years old. But I have heard that they've come in a lot younger than that with needing the surgery because they do have this disorder. The prevalence rate, which I got from the DSM-5, was the 12-month prevalence in adults and adolescents is 1 to 2%. And it also states that females are more frequently affected than males, with a ratio of 10 to 1. The etiology of this is the cause is not known, which they gave an example, such as the common cold. Nobody really knows what the common cold is, what the cause of it is, because there are various different viruses that can be caught. So same thing with this, even because they don't get it from a virus, but they still can't pinpoint exactly what the cause of this disorder is. Research has found that the pulling behavior could serve as a coping mechanism for anxiety and other difficult emotions. Which with this behavior, it's not hurtful, or they don't get hurt when they do this, such as someone that would use like cutting or something to deal with their difficult emotions. The average age that they stated is 11, but it can be found in children as young as 1 year old. And multiple theories have proposed, and it's generally agreed that the manifestation of trichotillomania is a result of some combination of biological, physiological, and social factors. Some of the etiology of the psychological is contrary to what this behavior might or could exhibit, or one might think. The individual is usually pretty happy and well adjusted. And as we mentioned earlier, it does occur in times of anxiety, stress, or trauma, or any other emotional disturbance that this individual may be experiencing. The hair pulling alone is not evidence of emotional disturbance or abuse, but it does not exclude it from the problems either. And depression is very common in people with trichotillomania, and should always be screened for that, the start of treatment for the trichotillomania. And I actually found a lot of information on depression as being attributed to the trichotillomania. But in order to keep the slides down to a minimum, I just felt it was important to make sure that is mentioned. High rates of comorbid mood and anxiety disorders have been found among patients presenting for trichotillomania treatment, while high rates of trichotillomania have been observed among individuals with tic disorders and, as we mentioned earlier, obsessive compulsive disorder, which is OCD. Evidence-based assessments are practice rating scales that have demonstrated empirical support for assessing a construct within a given population, which is usually the population of those suffering from trichotillomania. Post-traumatic stress, trauma are stated to have or play a role in the etiology of trichotillomania. I also had found a story in regards to a 6-year-old girl who was referred to an outpatient clinic. There was no family history or anything else, but she was diagnosed with ADHD and trichotillomania, which she was experiencing a lot of mood changes and temper tantrums. When she was admitted, she didn't have any eyebrows or eyelashes, and she was irritable with the tantrums and the aggressive behavior. And some of the things that kind of caught my eye was her thoughts, her depressive thoughts, and her thinking that she was ugly and that her mother was mean and that nobody loved her. So those kind of actually just caught my attention in looking at this story. Some of the biological, as they have evidence that indicates it's a neurobiological disorder that may be genetics, which I did read a story, or an article, which I was unable to go back and locate, that did do research on identical twins to be able to prove that genetics does play a factor in this. People with trichotillomania in general have a neurological-based predisposition to pull their hair for a self-soothing mechanism. So it's triggered by simple sensory events such as itching, eyelashes, or stressful life events, as we had mentioned earlier. There are significant associations in the white matter tracts of the frontal striatal thalamic pathway with a longer hair pulling disorder duration and severity. White matter integrity of the frontal striatal thalamic pathways of the hair pulling disorder is related to symptoms and duration, and neural abnormalities in the amygdalo-hippocampal formation of the frontal subcortical circuits. Some of the treatments that I found was CBT, which is cognitive behavioral therapy, which they're looking to alter the behavior by identifying the precise factors and trigger of hair pulling. It's based on the learning theory shown that we practice new behaviors, thoughts, and responses to familiar emotions or situations. Our brain's physical structure actually changes too, and we develop new neural pathways with the repetition of new behavior. Medications usually aren't used only because some people react differently, but if there are medications that are used, it's usually those within the category of the SRI and SSRI groups. Another one that I found was group therapy, which was beneficial for these individuals, for them to be engaged within a group of people that do that as well, and along with getting the parents or loved ones within a group as well who had dealt with the frustrations of this disorder. Another one is acceptance enhanced behavioral therapy, which with this therapy, what I read is it's usually those who are pulling unconsciously, because it really doesn't work for those that pull consciously, because they're already aware of their pulling, and therefore the acceptance therapy would not apply for this population of the hair pullers. And within this therapy, there's a habit reversal training, there's psychoeducation, and then like acceptance and commitments therapy. The faith integration scripture, I believe, would be beneficial in being able to make these individuals aware of God's word and how he feels about these addictions or behaviors, teaching them to realize that God's love is powerful, which, I thought about that story of the 6-year-old girl, and also because they're feeling alone or depressed, to let them know that they always have someone by their side, and to remind them that God does view our bodies as temples, which we need to take care of because what he has created for us, because we are all beautiful in his eyes. And finally there, we are on our last slide here, which is, I found actually quite a few different scriptures, but there's two that I found, Corinthians 10:13 and James 1:12-15, which basically, to me, is just stating that, we're not going to, we're not given any temptations or anything that God doesn't believe that we can handle. So, so basically don't give up on this, and that we do have the ability to get through it. So, and I believe that is it. So, thank you very much for listening.